Welcome to The Explainer. If you've walked down a supplement aisle or even just scrolled through your phone lately, you have been hit over the head with one thing: probiotics. They're literally everywhere. They're in capsules, gummies, those little yogurt drinks, you name it. And they promise the world, right? Better digestion, a super strong immune system. But all this popularity, it's created a ton of confusion. So, let's just cut through all that noise. What's the real story here? We're going to separate the actual evidence-backed facts from the popular fiction by digging into the latest clinical guidance. Okay, first things first, let's get our terms straight. We are focused on probiotics. The official definition is pretty simple. They're live microorganisms that, when administered in adequate amounts, confer a health benefit. Now, it's super important not to confuse them with prebiotics. Think of prebiotics as the lunchbox for the probiotics. They're the food that helps them do their job.
All right, let's tackle the biggest idea out there, that probiotics are basically this magic bullet for any and all serious gut health problems. So, is that true? Let's put it to the test. You hear this hope a lot, that maybe, just maybe, taking a daily probiotic could help manage a serious inflammatory bowel disease like Crohn's.
Yeah, but when you actually look at the mountains of scientific evidence we have right now, the data just doesn't back that up. For now, this one is firmly in the fiction category. And look, this isn't just one study's opinion. We're talking about a major scientific consensus. Top-tier expert groups like the World Gastroenterology Organization are on the record saying there's no solid proof they help with Crohn's remission. And here in the US, the American Gastroenterological Association agrees, saying they should really only be used if you're part of a formal clinical trial.
Okay, fine. What about a different situation? Can they help treat a really specific, nasty gut infection like Clostridioides difficile, or what most people call C. diff?
Well, unfortunately, it's kind of a similar story here. The evidence we have is just way too inconsistent to make a sweeping recommendation for using them as a treatment.
So you're probably asking, why all the caution? Well, it comes down to a word researchers use: heterogeneous. And all that really means is that the study results are all over the map. Some show a benefit, some don't. This messiness creates what's called a knowledge gap, and that's exactly why major guidelines, again from groups like the AGA, say to steer clear of using them for C. diff unless you're in a proper trial.
Okay, so if probiotics aren't some kind of cure-all, the next logical question is, are they at least safe for everybody? And this is a really, really critical question when we start talking about the most vulnerable among us.
And this is where things get really complex. Because when it comes to preterm infants, even the top experts are a bit divided. You've got the American Academy of Pediatrics, the AAP, saying, nope, don't use them routinely. But then you have the American Gastroenterological Association, the AGA, suggesting that certain strains might be useful. But here's the key: only to prevent a very serious condition, not to treat it. This split really shows you just how nuanced this whole conversation is.
So, why is the AAP so cautious? Well, it boils down to two huge concerns. First, the data we have on whether they're safe and effective is frankly conflicting. And second, and this part is so important for all of us to understand, probiotics are sold as supplements. That means they don't go through the same strict FDA regulation that prescription drugs do. All right, we have busted some pretty big myths, so now let's pivot. Let's talk about where the science is showing some real, exciting, evidence-backed promise. It turns out there's one area where we do see strong, consistent evidence, and that's in liver health. Specifically, a whole bunch of studies show that probiotics can provide real, measurable benefits for a condition called metabolic dysfunction-associated steatotic liver disease, or MSLD for short.
And we are not talking about some tiny, isolated study here. The evidence for this comes from a major meta-analysis, which is like a study of studies, that pool together the data from over 5,100 people. That's a huge sample size.
And the results from that massive analysis? They were seriously impressive. They found that using probiotics was linked to significant drops in key liver enzymes. Those are markers of stress on your liver. But not just that. They also saw improvements in other really important things like triglycerides, insulin resistance, and even body mass index. So, after all of that, the myths, the facts, the warnings, what does this actually mean for you, standing in the supplement aisle, staring at a wall of bottles?
If there is one thing, just one thing, you take away from all this, please let it be this. Specificity is everything. Probiotics aren't just good or bad. They are specific. It is all about getting the right strain for the right condition.
So here's a super simple 3-step framework to think about this. 1. Figure out your specific evidence-backed health goal. Don't just take one for gut health. 2. Do a little homework and look for the exact probiotic strains that have actually been studied for that goal. And 3, and honestly, this is the most important step of all, talk to a doctor or another healthcare professional to see if it's the right choice for you.
Ultimately, the science is screaming at us to stop thinking of probiotics as some kind of magic pill. The future of gut health isn't about finding a single cure-all. It's about precision. The real question we need to start asking isn't, should I take a probiotic, but rather, which specific strain, for whom, and for what exact purpose? Answering that question, well, that's the next great frontier.